So just to begin, we're going to go through a case study tonight of a family. It's representative of a family from a refugee background. And as we go through the case study, we'll then go through our speakers. So just to begin, we have Marie Claire, who is a 40-year-old Congolese lady who's arrived in Australia on a woman at risk visa just in the last month. So Marie Claire has 6 children, aged from 2 to 17 years, and she's currently 20 weeks pregnant with baby number 7. The family are living in rental accommodation and have a lease for the next 6 months. Previously, they were living in a refugee camp in Tanzania for the last 8 years before coming to Australia, where they had minimal access to basic health care. Marie Claire's husband, who is the father of her youngest 3 children and baby, who she's pregnant with, is still living in the camp, and she's very hopeful that he will be able to join the family in the next 12 months. So Marie Claire is HIV positive and has been on antiretroviral therapy since she was diagnosed in 2008. She's arrived in Australia with just a 2-week supply of medication. All of her children were born by vaginal delivery and were breastfed. The first 3 were born prior to her diagnosis and the last 3 after her diagnosis. She also had a postpartum hemorrhage during the birth of her 14-year-old daughter Precious, and at that time received a blood transfusion. So with beginning the case, we have a few questions initially. How would a diagnosis of HIV be viewed by Marie Claire and her community? How can health professionals address, her diagnosis in a sensitive way? And what are the perceptions of HIV testing in her and other countries of origin and in Australia? So to help us answer these questions, we'll start with our first speakers. And our first 2 speakers are going to talk to us about community perspectives of HIV. And our first 2 speakers are both members of the Refugee Health Community Advisory Group, also known as the G11. A group of 11 health development consultants from diverse refugee backgrounds who are all regarded as leaders in their respective communities. So I'd like to ask Samira and Maria to come forward, please. So Samira is originally from Eritrea and has lived in Australia. Oh, Samira's coming here. And has lived in Australia for over 10 years. Before coming to Australia, she lived in the Netherlands for nearly 11 years and completed high school and a degree in nutrition science in Australia. She's worked with MDA as a cultural support worker and at QPAST, providing support for single mothers. Samira has also worked as an interpreter for 10 years, and she's well linked with new arrivals from refugee backgrounds and the refugee health sector, and has been part of the G11 for 7 years. I'd also like to introduce Maria Phaltang, who was born in South Sudan and grew up in Kenya. While she was in Kenya, she worked as an interpreter for 8 years. Maria came to Australia 10 years ago and completed high school and her Bachelor of Nursing here. She's worked as an assistant in nursing at the Mater Refugee Complex Care Clinic and has been part of the G11 for 4 years. Maria currently works as an assistant in nursing at the Mater. So please introduce Maria and Samira.
Good evening, everyone. Thank you for coming and thank you for giving us a chance to speak about our community perspective. So I will say pretty much the introduction and then Maria will move on. So what I have to say about HIV is my perspective, my experience and what I knew and what I know now. So prior to 2001, there was no treatments for HIV/AIDS in Africa at all. Most of African country, maybe some in South African, but At that time, when I grew up there in early 19s, I was very young, and I know the condition as AIDS, and I later on know that it's called HIV as well, but we call it as AIDS, and it was a very scary condition. We used to run away from people who are having it, not because we don't like them, but because they look very scary. They look very scary. There was no inpatient center for them. There were so many of them. And people just, we know, as a community member, and all of a sudden, they look very skinny and they've got something on their skin. Now I know that HIV can cause a skin cancer as well. And they, you can only run away, but nothing else. I feel sometimes, as a child was I mean, but it wasn't. I think no one has seen that kind of picture unless you lived in that country at that time, in those kind of country at that time. It is hard to describe. They look different, their lips were different, they have no hair. And as a child, you can only run away and be scared of them. And we've seen many people died. We've seen many people neglected by their own family because, of course, I think people has very little chance and very little information about what it is and how contagious it is. And so it was a very dramatic experience for me when I think of those pictures, when I think of the people that I knew and that later on died. And that is still having that picture. When people say ghost, that is what I think, that kind of picture in my mind, but then with the real person that were living among us at that time. But now it is good. If I mention my own country, Eritrea, about 60% of adults living with HIV has access for medication. And people know the condition is not deadly anymore. It can be managed, and they can live. So it is good news, and we can see that it is declining as well. But there is a big but. The social aspect of the exclusion was regarded as not having life. So not only back home, even here, people who live with HIV, they're very depressed. They cannot talk about it, even with their own medical practitioner. They don't talk about it. They're not open about it. I've seen so many people with HIV positive. I become to know because I'm their interpreter. Then when we go to a dentist, they would not tell that they are HIV positive. Lately, there was a woman who was diagnosed with breast cancer and seeing an oncologist, and she would not open up about that, even though her breast cancer is more scary than HIV. I think my thinking for the stigma or for the fear that people don't want to hide it or don't want to share it, don't want to be open, they don't want to be open about it is more because of the trauma that they have seen back home. It is still, the image is still there, and even though the condition doesn't do that any longer, they've got that picture and they've got that image, and they don't want people to know. And they are traumatized by the image, by the thinking. I think that's why for them life is not moving forward. They don't think of marriage, they don't think of relationship, they don't think of being open about it, or or seeing it as a normal condition that it can be treated. Whereas when you compare it with hepatitis B, and I think it is equal and maybe even better manageable condition, HIV, but people are living still the trauma that they have suffered or they have seen, they have witnessed in the early 90s, maybe 80 as well, and also early 2000. I think that is still in their mind, and so that's why they cannot move on. They cannot be hopeful about life, and they cannot be open about the condition they have, and they cannot be hopeful about the condition they have. In Eritrea, I think the acceptance is still not there. And by law, you are required to have HIV tests before you get married. If you want a marriage certificate, whatever it is, in mosque or in church or in the council, you have to provide the test for HIV. I don't think they don't allow you not to get married if you are positive, but then you have to present that. Yes, it is good to minimize transmission, but I don't think it is ethical for someone to be, I mean, marriage is a social event rather than an individual or a two people thing back home. And by doing this, I think you, especially if that person's know, or if those couples know, I think you're exposing them to another level of trauma or emotional distress. So I don't know what to think of it. I always oppose it, it is up to the couple to take that decision and to do it among them, and it should not be compulsory, because that is bringing another trauma. That is my thinking. This is what I have to say about HIV, and I hope people somewhere, especially people in Australia, have a support group that they could, not from with their community, they would not talk with their own community, because they know the consequences. I can give you another example. This is a lady with one child who lost her husband and who came to Australia and who lost one of her child. So she came with one child. She's a beautiful lady, young lady in her early 30s, and she only have one child. And in the Ethiopian Eritrean community, one child means no child. That is a say. So, or you need to have more, And this lady, no one knows, and you can see the trauma that she have, having HIV or living with HIV, even though her virus is not detectable and she's managing well and she's doing well. But she met this person who really wanted to have a genuine relationship with her, and he'd been asking her, we can get tested if you don't trust me, because that is the normal practice back home. You get tested before you go into the relationship. And she felt very much traumatized by it, and she went to her doctor and cry and cry and cry. But this is the situation. You can do this. This is, you can even have a healthy life, a healthy child, and healthy relationship with that. But even after she had all this information, the main problem with her was telling him. So I cannot tell him, otherwise he will then tell other people, then people would not extend a hand to me. People will hate me. So that is the image, I think, that we had all in the 90s, that we used to run away from those people. Thank you. That's what I have to say.
Do I need to talk?
No.
I don't think I need to talk, but I'll just say something just for the sake of standing here. She mostly said everything. I'm from South Sudan, which is a bit different from her culture. Our biggest challenge is we are a polygamous country. So a woman is meant to have one husband, but a man has multiple. So when it comes to HIV understanding, that becomes so confusing because nobody knows where they get the infection because they are more sharing the same man. So the perception of HIV in my community is very stigmatizing. It's a taboo that people don't talk about it. I'm talking from a personal experience that I have. My cousin that I lost in 2015 and left 3 children. And the children are here in Australia, but in the family there is no day that we had that conversation on the table just to talk about it. I don't even know which of the 3 children is actually negative and which one could be positive, because it's something that cannot be discussed, but they're still in Australia, so that shows how much stigmatizing it could be. And when it's known that this person is positive, there is this, I call it bully, because people say jokes about you. They might say, oh, you don't have to associate with so-and-so because you might get HIV, they're HIV positive, you don't have to eat with them. And that is because there is no education about it. There is no knowledge about the fact that you cannot actually casually get infected. Samira said a lot, so I'll just go to the testing part of it. I was reading an article today from Juba. I think it was done by the UNHCR in 2017 with the soldiers, the SPLA soldiers in Juba. So this guy was asking them how much they understand about the HIV. So the question was, if one of the soldiers is HIV positive, healthy and strong, could he remain with the group or could he just be actually sent home from the service? And 60% or over 60% of the population that was questioned said they were meant to go home. So again, when you are HIV positive, it doesn't actually stop you from your daily living activities or anything like that. You could still live with it healthy and continue with your life. Which other question? What was the other question? So when it comes to testing again, back in Africa or back in South Sudan and here in Australia, I think in South Sudan, the health professionals don't get actually that trust that their testing is so accurate. But here in Australia, I think a lot of people think, oh, these white man machines don't lie and maybe I'm actually positive. So I think there's more trust here than in Africa. And I think I don't have much to say. That is something that I need to share with you guys. In 2006, before I came to Australia, we had a relative that her husband went to work somewhere and then dated a lady who was known to be HIV positive. And one of her cousins said, oh, you know what? When your man was here, he was mingling with this lady. So when he comes home, get him tested. So his wife said, oh, before anything, I need you tested. And he said, oh, that means you've been cheating. So for me, I don't have to get tested. That means you don't trust yourself. That's why. And that got them divorced because the lady said, I want a test. And the man said, I don't want a test. And they had to divorce. It turned out that that man was actually infected. So when it comes to testing, that is more than we think. And I think that is where I will stop. Sorry if I didn't get it right. Thank you.
Thank you, Maria and Samira. You've really given us a lot to be aware of and think about when we're seeing people. Sorry, Maria. And Samira, talking about your community not wanting to talk amongst each other, we will be hearing from QPP and ECCQ later that will be able to offer some support